Hello, welcome, and Kumusta. Thank you for joining me. This is How, your occupational therapist, and welcome to OT Conversations. In this episode, I'd like to talk about the two types of OT treatment interventions. Whenever you see patients after the assessment, goal setting, and discharge planning, the next big part of occupational therapy is the treatment implementation. This is when you work to change a person's ability through a DL retraining or performance component retraining. There are two types of treatment sessions. The first is a typical OT session. Here, you deliver exercises, activities, passive stretches, and functional mobility retraining. For example, getting a person out of bed to stand up and walk to the edge of the room and back. This type of session is often quick and routine. The second type of session is more significant and insightful. It's not just about completing the tasks, but addressing the patient's problems and helping them genuinely. For instance, if a patient has difficulty getting out of bed, you wait and let them try multiple times until they experience and understand the movement. In such insightful sessions, you focus on building the patient's abilities and confidence. You start with easier tasks like raising the bed slightly to help them stand and gradually increase the difficulty. You also ask for their feedback about what they are feeling and acknowledging their limitations and progress. When dealing with tasks like walking, if the patient struggles, you adapt the exercise. You might set up chairs around the bed for them to transfer from one to another, encouraging safe and controlled movements. This kind of session is more emotive and focused on truly helping the patient improve. For upper limb training, some therapists do quick active assist movements which are more like warm-ups. Instead, true retraining involves isolating each muscle movement, repeating activities until the patient can move the limb properly. This kind of training helps patients regain proper motor control. Effectively, your job as a therapist becomes fulfilling because you're helping patients in a supportive role. You're not just a directive clinician, you're a coach, enabler, and cheerleader. You design activities based on the patient's abilities and provide the right amount of challenge. In every session, there are typically three components: adjunctive activities or warm-ups, enabling activities which we may see as repetitive task components, and purposeful activities or ADL retraining. Depending on the patient's condition, you may rely more on some components than others. For instance, in critical care, you might focus more on adjunctive activities. In a ward setting, you might skip the warm-ups and go straight to enabling or purposeful activities, depending on the patient's wellness. The goal is to progress them through these stages as they improve. Think about your sessions. Are they simply tasks to complete that will enable you to get through your working day, or are they genuinely designed to help the patient? I've observed some clinicians who only do one task per session. It's more effective to be invested in truly helping patients, even if it means returning later to complete a task. Thank you so much for listening. I hope you learned something valuable today. Share and discuss this with your colleagues to grow together. Remember, everything you do matters and has an outcome. Until next time, bye.